Hey guys, and welcome to How to Gastro. In today's presentation, we will be talking about gastritis. So let's get into it. So what is gastritis? Gastritis is an inflammatory process with irritation and/or the erosion of the innermost layer of the stomach, which is called the mucosa. The process can occur over a short period of time, and if this occurs, we call it an acute gastritis, or gradually over a longer period, in which time we name it a chronic gastritis. So you can see the picture above. We have the stomach, and this is the normal endoscopic view of the stomach, and you can see in gastritis we have this inflammation of the stomach lining, which is the mucosa. The innermost layer of the stomach is called the mucosa. So you can see these erosions taking place in the mucosa, as well as it seems very red, very irritated, and it's highly inflamed. And you can see in this little bubble, that's a closer look. And in comparison to the normal mucosa of the stomach, you can actually see there is quite a vast difference indeed. So what are the causes of gastritis? Gastritis can be due to a Helicobacter pylori or H. pylori infection, patients who are chronic alcoholics, using certain medications like aspirin or other NSAIDs, having biliary reflux, which is a disease with chronic backflow of bile into the stomach, chronic vomiting, having Crohn's disease, which is inflammation of the digestive tract at various points, having an autoimmune condition called autoimmune gastritis, which is when the body makes antibodies that attack the parietal cells in the stomach. So the parietal cells are these cells that are found within the lining of the stomach. And this results in atrophic gastritis, which can destroy the stomach lining. And something to note here is that people who suffer from autoimmune gastritis have a 3-fold increased rate of developing an adenocarcinoma. So that is gastric cancer. So that is something to keep in mind. Continuing with the causes for gastritis, we can also have excessive cigarette smoking and having certain viruses such as the herpes simplex virus, which can lead to gastritis. And below I just put in a picture of the gastritis, which is caused by having biliary reflux. And you can see that the bile empties in this part of the GI tract, which is the duodenum. But instead of it going and continuing down the GI tract, we have this backflow into the stomach. And because the stomach is an acidic environment and this bile is alkaline, it's going to cause irritation to this lining. And that's why we have the development of gastritis in biliary reflux. And this is just a microscopic view of what the H. pylori infection looks like. And H. pylori is actually the most common cause of gastritis. So what are the symptoms of gastritis? Nausea or a twisting pain in the epigastrium, abdominal bloating, heartburn, vomiting, indigestion, experiencing a burning feeling in the stomach between meals or at night, vomiting blood or coffee ground-like material, which is called hematemesis, and having black, tarry stools, which is called melena. Now let's talk about the diagnosis of gastritis. The patient's symptoms can be helpful in leading us to the pathology. However, we do require some diagnostic procedures for confirmation. These diagnostic procedures include an upper GI endoscopy, blood tests to determine whether the patient has anemia. We could also use the blood sample to screen for the H. pylori infection and pernicious anemia, because patients suffering from atrophic gastritis suffer from a vitamin B12 malabsorption and frequently have pernicious anemia. We can also do a fecal occult blood test, which is a stool test that checks for the presence of blood in the stool. So because that stomach is going to be inflamed, irritated, it's going to bleed out. And those little spots of blood can be picked up in the stool, and that's where the fecal occult blood test is useful. And this will also be useful in the blood test because the patient is losing a fair amount of blood from the inflamed stomach. It's going to lead to him developing an anemia. And as we said earlier, one of the causes for gastritis was an autoimmune disease, and the body produces these antibodies against those parietal cells of the stomach. And this is helpful because from the blood test, we could notice a vitamin B12 deficiency. And they frequently develop pernicious anemia. So the blood test can be helpful in diagnosing the patient with this autoimmune pathology as well. And of course, the upper GI endoscopy will show us a clear image. When we put that scope down, we'll be able to see the erosions, the inflammation, the redness of the stomach lining or the mucosa. So that is the most helpful tool by far in the diagnosis. Treatment for gastritis. We could start by making some lifestyle changes, such as avoiding alcohol, spicy foods, acidic beverages, such as orange juice or pineapple juice, smoking, and taking medications such as aspirin that have a very nasty effect on the stomach. And this is the basic non-pharmacological therapy. And this is what we can start the patient's off with, just by educating them on making better dietary choices to help them with the pathology. And this is very useful because if they do follow this better diet plan, they will notice that their symptoms start to disappear, or they don't have them that frequently. In terms of medical treatment, the initial treatments are aimed at using drugs that work to reduce the amount of acid that is being released into the digestive tract. We can start off with antacids, which neutralize the stomach acids, and examples are Maalox, Melanta, Gelusil, Gaviscon, and Rolaids. So another way to combat that highly acidic environment of the stomach is to use the proton pump inhibitors, or the PPIs. Some examples of these drugs are esomeprazole, lansoprazole, omeprazole, pantoprazole, rabeprazole, and dexlansoprazole. Also used to reduce the acid production, we can use the H2 receptor blockers, and these medications include cimetidine, formetidine, nizatidine, or ranitidine. And something to note is that the proton pump inhibitors, so the medication that I mentioned before this, so let's go back to that slide. These examples again, lansoprazole, omeprazole, esomeprazole, these are actually stronger blockers of acid production than the H2 receptor blockers. So they're better at combating the acid problem than these H2 blockers. So something to keep in mind, as I mentioned earlier, is that the Helicobacter pylori infection is actually the #1 cause for the development of gastritis. So what we do have to do in those cases is treat the Helicobacter pylori infection. I did do a video on Helicobacter pylori, so if you guys are more interested in watching that entire video explaining what it is all about and the treatments, the symptoms, the signs, you can give that a watch. I will put a link in the description for it. So for the treatment of Helicobacter pylori, again, we can administer the triple therapy for 10 to 14 days. And there are 3 treatment regimens which I use. The first one is omeprazole, amoxicillin, and clarithromycin for 10 days, bismuth subsalicate, metronidazole, or tetracycline for 14 days, or lansoprazole, amoxicillin, and clarithromycin, which has been approved for either 10 days or for 14 days of treatment. And that brings us to the end of the presentation. Thank you guys so much for watching. Please make sure to hit that subscribe button, like, comment, and share. And if you would like to download a copy of this presentation, you can click the link in the description. Take care. See you soon. Bye for now.